Hey Sandy, how you doing?
I'm good, how are you?
Just fine. Hey, I was thinking about going over to Bee City. You want to join me?
I hope, that sounds like there's a lot of bees over there, are there?
Bee City? Nah, forget about it. It's just a name.
Okay, because I'm allergic to bees, so, you know, I don't want to be where a lot of bees are.
Forget about it. We're going to Bee City.
Alright, well, if I get stung, I hope you know how to respond.
Oh, I totally do. That's the one thing that I know everything about.
Okay, well, I think we should be good then. If you say there's no bees and you know how to respond.
Mm-hmm. Alright.
Wow, there are sure a lot of bees in Bee City. Oh, oh no! Should I pass out?
Oh no, what happened to you, Sandy? Oh my goodness, who would have known that there'd be bees in a place like Bee City?
Oh no! It looks like she's having anaphylactic shock.
Anaphylactic shock? What's that?
According to this source that I have, it's a severe, potentially life-threatening allergic reaction.
That's probably what she's got. She don't look so good.
I know, so we should probably do something. Let me read.
What should I do? I've forgotten everything that I know about bee stings.
Does she have an EpiPen?
An EpiPen? What's that?
An EpiPen?
Don't worry, we can edit this.
Should you? I have one of your pens or your highlighters.
No, use this.
Oh, okay.
Yeah.
Okay. Okay. An EpiPen.
What's an EpiPen?
It has epinephrine, which it would reverse the symptoms that she's having right now.
Well, I sure want to do that.
Did you know that anaphylactic shock is caused by
Go on.
by exposure to allergens such as bee stings?
That would make
peanuts.
sense. Peanuts? Get out of here.
Even food.
Alright.
Even exercise, according to this source that I have.
Forget about it.
Okay. So according to the symptoms that she's experiencing, you know, she has hives.
Yes. She's starting to swell up some.
She feels warm.
Doesn't look like she's breathing all that well.
And her pulse is weak and rapid.
Holy moly.
And she's fainting.
She's fainted, that's for sure. She's definitely done that.
So, does she have an EpiPen?
I have had one in my pocket the whole entire time. I just forgot what it was.
Oh, you should probably inject it on her ventrogluteal site.
Totally. I'm so going to do that. All right. Are you ready for this? Yeah.
Good.
All right. She definitely seems to have improved a little bit.
Let's see.
I don't know.
She has a pulse.
She has a pulse?
We don't have to do CPR.
Oh, right.
It's cool. Okay. Because I forgot CPR. That's good. How to do that? So, do you know what causes anaphylactic shock?
Bee stings and peanuts.
Well, there's more.
There's more?
Medications such as penicillin.
Penicillin can cause anaphylaxis?
Even milks and eggs and shellfish.
Holy moly.
Even latex.
Latex? Uh-oh.
I know. So, let's hope she doesn't have any complications.
I don't want her to have complications. What kind of complications could she be having?
Death, I believe.
Nice nonchalant way to say that. Alright. Okay.
Oh, Sandy.
Sandy, I'm glad you're doing all right now.
Did you stab me with an EpiPen?
I sure did.
That did it. I was experiencing some itchiness and my throat felt like there was a lump in it and all this crazy stuff. So man, I'm glad. How can I prevent this in the future?
Well, you can prevent this in the future by removing the cause of the reaction, You can wear a medical alert necklace or a bracelet to indicate
I'm
that
gonna get one of those.
you have an allergy to specific drugs or other substances. You can alert your doctor to your drug allergies before any operations or flu shots or any injections. Also, you can exercise caution when nearby insects are nearby. If you're
So not go to Bee City is
Yes,
probably a better idea.
that would be a good idea. Also, carefully read the labels if you have food allergies. That way you don't accidentally eat them and have shock again.
Exactly.
Mhm.
So, lesson to be learned. Don't go to places with lots of bees, and be prepared,
Mhm.
and make sure the person who's with you knows what they're doing.
Mhm.
Yeah. Perfect.
Okay. To recap on anaphylaxis or anaphylactic shock, it's a condition where someone is exposed to something that they're allergic to, and they have a severe allergic reaction to it. Their immune system will cause their throat to swell up, make it difficult for them to breathe. They'll break out in hives or rashes, and they may get dizzy, they may get nausea, vomiting, swelling may be so bad that it's so difficult for them to breathe that they just pass out. They're not getting oxygen to their tissues, not getting oxygen to their brain, and so they just conk out on the floor. Common allergies, you'll see they'll have a severe reaction like that. Bee stings, peanut allergies, seafood allergies, medications, and how you would treat that is if they have an EpiPen, give them their epinephrine immediately. You're going to give that on the outside of the thigh. You're going to hold the EpiPen there for 10 seconds. Let the medication completely go in there. If you just stab them in their leg and then you just take it right on out, you didn't do them any good. So, epinephrine, call 911 immediately. How else can you treat that? Give them oxygen. It's already difficult for them to breathe. When they get to the hospital, they'll be given some antihistamines and breathing treatments like albuterol. And just keep them happy and healthy until they stop having their allergic reaction. Do you have anything to say?
No, what you said.
Say bye-bye.
Bye-bye.
That's all, folks.